Hello, I'm Llewellyn, the co-host of CFS Alert, and I'm in Mountain View, California, talking to Dr. Andreas Kogelnik, who is the founder, the inspiration, and the director of the Open Medicine Institute, a new organization, very new, they haven't even got the furniture in the building yet, that is going to look at creating a global network of information on CFS, as well as practicing medicine for CFS sufferers. The doctor, I believe you already have some patients, quite a lot. Like, how many patients do you have?
We're closing in on about 1,000 active patients.
1,000 patients, but the other part of your work is this informational network between all the clinics so that you're not treading the same ground, replicating. Is that correct?
That's right.
What do you think the role of government in research for CFS is?
Well, I think...
Or should be?
I think it would be wonderful if government took a central role in terms of funding efforts and investigating CFS as a one disease or even as several diseases. But I think we've seen a lackluster effort there in past years. I think some of that may be changing, and certainly there's a lot of pressure to change that. So I would love to see, and we're part of an effort to continue pushing that forward.
Would you like to see the research done in the National Institutes of Health, or would you like to see them funding, or the Center for Disease Control funding organizations such as your own?
Well, the CDC has actually already funded us to a certain degree in our network to do some of the research there, so we're very excited about that. Frankly, I think there's so much to be done that it would be great to see any of the organizations putting a larger sum of funding forward, both internal as well as external, towards CFS.
Tell me about the network. I understand that what you're going to do is to try to get, as well as learning what other doctors are doing and what the clinics are doing, but direct input from patients, how they're feeling, what their blood pressure is, how their day is. How's that going to work?
That's right. So one of the key strategies that we've adopted is providing an infrastructure, both a biotechnology infrastructure as well as an information technology infrastructure, so computers in the hands of the physicians who are seeing these patients, but also reaching out via the web and other mobile devices to patients directly and allowing them to input their own data that we can then view in summary for research purposes, as well as involve them in clinical trials. So we have direct devices that lay in the hands of patients, or they can come in via the web and give us information that way.
But would they have to report regularly? These are very sick people, some of them. They're not always in good shape to get up and go to a computer or
one of the strengths of what we're doing is some kind of regular assessment, but certainly we want to involve as many people as we can. So for specific protocols, we'll require every 3-month evaluation or whatever the protocol calls for. We're also building a registry where any patient can come in and just let us know that they exist and let us know a little bit about their symptoms and severity of disease.
That would seem to be very important. I get a lot of emails since I've been writing about and broadcasting about CFS from very sad people who don't know where to turn. My sort of example of this is a woman in West Virginia who says, "What can I do? There is no doctor here who will help me. There is no support group." And people like that, you could at least provide some support.
That's right.
And information.
That's right. And we hear that so often. It's really terrible in terms of the number of patients that are out there that are suffering that have nowhere to turn. So this is an effort in part not only to provide a way for us to get data from them, but for us to be able to give them information that maybe they can use locally and help them find someone or find at least some kind of a treatment that eases some of their suffering.
The patients you're treating now as a doctor, what do you do for them?
Well, we have a number of angles that we run down as we see each patient. We look at each patient from an immunologic standpoint, so how is their immune system doing in terms of defending their body against any other pathogens or perhaps against themselves. And then we look at other components in terms of viral activity, presence of various viruses, and so forth. And then we look symptomatically at are there specific things we can do, like helping them with sleep, helping them with GI difficulties, and so forth. So we take a multifaceted approach and sort of a multi-system approach.
What sort of therapies are helping people? You can't cure them, you can't really alleviate their symptoms, but what therapies are helping them?
Well, taking off on some of the things we did up at Stanford before I left there 2 years ago, some of the antivirals have shown actually tremendous results in patients. We're looking at Rituxan with the Norwegians as a therapy that has actually been quite effective so far, but needs to be proven in a larger audience population. And then obviously a lot of symptomatic type treatment. One of the big things we're after is validating some of the things that have been proposed to date and making sure that they are truly effective and that patients aren't back to the same place 6 months later after they've gotten some expensive treatment. We want to make sure that the long-term follow-up is there, that these patients actually do improve with given therapies.
Dr. Andy, you said expensive treatment. Expense is a big issue. Is there any kind of financial help at the clinic for patients, or can you direct them to financial assistance if they don't have insurance, etc.?
We actually work with patients very closely to do whatever we can in terms of getting them under patient assistance programs from either the pharmaceutical manufacturers or government. So we've gotten a lot of patients free antivirals or free other medications for free, but there isn't, unfortunately, there's not a lot of pathways there, and there are so many patients out there that I wish we had some additional paths to follow there. One of the things we're trying to do is provide sort of web-based resources that scale, that might be helpful to individual patients, and do that for free.
Well, thank you very much indeed, and good luck in this noble undertaking.
Thanks so much.
If you would like to sponsor MECFS Alert, please contact us at mecfsalert@gmail.com. Help us to help you.